So, you've been experiencing severe toothache, keeping you up at night, and you need to find a dentist to get you out of trouble. Well, in this video, we're going to be looking at the dental emergency and the differences in the NHS and the private sectors. Hi guys, Dr. Raggy here at Your Dentist Says. Before we get into today's video, don't forget to subscribe to the channel, it means more than you know, and if you can give this video a cheeky like or share, that's much appreciated as well. So before we get going, a couple of disclosures. So I'm a fully private dentist now, however I did work within the NHS system for over 5 years, exiting in 2021. I have also worked in the community service as an NHS emergency dentist. That is the service that you get triaged to if you call 111 and your dentist is shut or you don't have a dentist at all. So I'd like to think I can give a pretty balanced view here, and this is by no means a Nash bashing video. And a disclaimer as well, I'm by no means suggesting that private care is superior. I'm merely suggesting the remuneration is very poor for your NHS dentist, and as such you are far less likely to receive comprehensive emergency dental care, as you will see by the end of this video. So firstly, let's explore what is a dental emergency. It can essentially be anything that bugs you enough that you want to see a dentist ASAP. This might well be a lost filling, it could be a lost crown, it could be a chipped tooth, it could be dental trauma. But for the purpose of this video, we're going to focus specifically on one kind of dental emergency, and that is raging toothache, keeping you up at night. It's throbbing, it's continuous, it's pulsatile, and you just need to do something about it, otherwise it's going to drive you bonkers. Now in this particular situation, we generally have two options. The tooth can be removed or it can be extirpated, which is essentially the first stage of a root canal procedure. Now this is quite a complex and intricate procedure needing lots of fancy kit and materials, but essentially you get the patient in and you place an intracanal dressing, that is an antibiotic paste, inside the nerve endings, root canals of the inflamed tooth. And this calms your symptoms down pretty quickly. The principal advantage here is that you get to keep the tooth if it's savable, and then when you're out of pain, you can make a rational decision whether you want to go ahead and have the root canal procedure, or you can still opt to remove it, but you haven't committed to an irreversible procedure. Now, under the NHS, you presently pay just one flat fee for your dental emergency. That is £23.80, I believe, and that covers your emergency assessment as well as any treatment that's carried out as well. Once again, this doesn't go to your dentist, this goes back to the government as a tax. Dentists and their practice get paid by UDAs, as I've covered in parts 1 to 3 in this 4-part series. A dental emergency, believe it or not, is just 1.2 UDAs. This means a practice with a UDA rate of £30 is going to receive £36 for the entire course of treatment. And with that money, they need to pay the dentist, they need to pay the nurse, they need to pay for all the materials and the whole upkeep and running of the practice itself. Your dentist, if they're on a UDA rate of £10, will receive just £12. And with that, that would be their fee for the examination, an X-ray, for the emergency dressing, and for the temporary filling as well. Now, because this fee is so low, they will typically have to work at rapid speed to make this viable for the practice. This might mean that you would just have a 15-minute slot to cover all of this treatment. Now, this is by no means an inevitability, and this is certainly a broader generalisation, but if you're not a cooperative patient on the NHS and your dentist can justify a course of antibiotics, then they might well be inclined to do this because they've got very limited time, very limited resources, and they get paid the same fee. So where am I going with all this? Well, it's another heavy video and they will get a bit lighter, I promise, but essentially I'd like to look at a plumber's analogy. Now suppose you have a leaking pipe in your ceiling and you need to call them ASAP to try and fix it. And suppose you did get them in and they are paid exactly the same for their call out if they just place a bucket there as they would if they actually went up and fixed the leaking pipes. Which option do you think your plumber would go for? Well, it's exactly the same scenario on the NHS, unfortunately. Your dentist has got very limited resources, limited time, but they're getting paid exactly the same to give you a script to get you out of trouble, that is the antibiotics, or to go ahead and do a very complex procedure such as a surgical extraction or an extirpation. In the private sector, we're going to charge you separately for the assessment itself, as well as the treatment provided to give you that pain relief, which I think is a lot fairer. So if you call your plumber, they're going to charge you a call out fee, whatever they do. If you break your laptop and you send it to a computer shop, they're going to charge you a fee just to look at it, and then they'll quote you for the repair itself. Surely your dentist should be paid in the same manner. By going private, your dentist will typically have more time, they can do things in an unhurried manner, they can use the latest equipment and fancy materials, without the constraints of the UDA system, and hopefully you'll get a better outcome. What do you make of all of this? Well, I'd love to know your thoughts, specifically your experiences of a dental emergency. Do drop us a comment in the section below, and I shall see you on the next one. Cheers.